Subscribe to our YouTube channel. Press the bell icon to get the latest updates.
Now is one of those times when I have to share the truth and I have to hope and trust you will listen. I'm going to pause here. I'm going to lose the script and I'm going to reflect on the recurring feeling I have of impending doom. We have so much to look forward to, so much promise and potential of where we are, and so much reason for hope. But right now I'm scared.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.
I want to begin with an overview of the continuing concerning trends in the data. Yesterday, we in the United States surpassed 30 million cases of COVID-19. CDC's most recent data show that the 7-day average of new cases is slightly less than 60,000 cases per day. This is a 10% increase compared to the prior 7-day period. Hospitalizations have also increased. The most recent 7-day average, about 4,800 admissions per day, is up from 4,600 admissions per day in the prior 7-day period. And deaths, which typically lag behind cases and hospitalizations, have now started to rise, increasing nearly 3% to a 7-day average of approximately 1,000 deaths per day. When I first started at CDC about 2 months ago, I made a promise to you. I would tell you the truth, even if it was not the news we wanted to hear. Now is one of those times when I have to share the truth and I have to hope and trust you will listen. I'm going to pause here. I'm going to lose the script and I'm going to reflect on the recurring feeling I have of impending doom. We have so much to look forward to, so much promise and potential of where we are, and so much reason for hope. But right now I'm scared. So I'm speaking today not necessarily as your CDC director, and not only as your CDC director, but as a wife, as a mother, as a daughter, to ask you to just please hold on a little while longer. I so badly want to be done. I know you all so badly want to be done. We are just almost there, but not quite yet. And so I'm asking you to just hold on a little longer, to get vaccinated when you can, so that all of those people that we all love will still be here when this pandemic ends. We have come such a long way. 3 historic scientific breakthrough vaccines, and we are rolling them out so very fast. The trajectory of the pandemic in the United States looks similar to many other countries in Europe, including Germany, Italy, and France. Looked like just a few weeks ago. And since that time, those countries have experienced a consistent and worrying spike in cases. We are not powerless. We can change this trajectory of the pandemic, but it will take all of us recommitting to following the public health prevention strategies consistently while we work to get the American public vaccinated. I'm calling on our elected officials, our faith-based communities, our civic leaders, and our other influencers in communities across the nation. And I'm calling on every single one of you to sound the alarm, to carry these messages into your community and your spheres of influence. We do not have the luxury of inaction. For the health of our country, we must work together now to prevent a 4th surge. Today, I'm excited to share information about a new CDC-led study that's being published in the MMWR. This study assesses the real-world effectiveness of the Pfizer and Moderna vaccines in preventing infections among nearly 4,000 healthcare personnel, first responders, and other essential workers in 6 states from mid-December to mid-March. The study found that the risk of infection was reduced by 90% after individuals received the 2 recommended doses of the vaccine. The study also found that people starting to get a protective effect even after the first dose, the risk of infection decreased by 80% after 2 weeks. Findings of this are all consistent with the clinical trial data. Importantly, people in the study received self-collected nasal swabs each week for laboratory testing, allowing CDC to look at evidence of COVID-19 infection whether or not people had symptoms. A small number of infections were asymptomatic. However, most infections occurred among people whose infections were identified by testing before they developed symptoms or knew they were infected. This study also demonstrates that 2 vaccines can reduce the risk of COVID-19 infections, not just in symptomatic infections, but also in asymptomatic or pre-symptomatic infections. This study is tremendously encouraging and complements other recent studies published in New England Journal of Medicine. Finally, I want to share today that CDC is making important updates to the list of underlying medical conditions that can increase risk of severe COVID-19 outcomes. This update is keeping up with my commitment to lead with science, to have clear information on our website, and to better describe the science underlying these conditions. After a thorough review of the evidence, we have simplified the list of underlying conditions for consumers and created a new page for healthcare providers. This will make it easier for patients and the public and providers to understand the important information related to their underlying medical conditions and its potential impact on COVID-19 severity. We have also updated the list of underlying medical conditions to include substance use disorders, based on evidence that having these conditions can increase risk of severe illness or death from COVID-19. You can now visit the CDC website to learn more about these underlying medical conditions and the science evidence used to support their inclusion in the list.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.